Welcome, everybody, to this episode of Freedom Hub's Free Market Cash Patient. I'm your host, Jeff Cantor, along with Charles Froman. We are being sponsored by the Freedom Hub, which we are for sure the disruptors intersection, as you will see or already know. And we definitely have some issues in terms of the healthcare world. And so we're going to have a very timely guest tonight. But it is a real problem, and it's up to us to take back control of it. No legislator or anybody else is going to bail us out. So you're going to learn a lot. Now, we're trying to help drive it. So we're working with an award-winning app that allows you to connect with cash-paying doctors and be able to kind of bypass all this third-party pay nonsense, and also liberate the doctors because they get to set their own pricing and everything for a change too, which is great. We've got a special website set up for that purpose. Please go ahead and take a look at that. And then you also want to visit our main website. So let's take a quick detour over there before we dig in for today. And we are at the homepage. There's a lot of really great areas to check in these drop downs. Today we're on this first tab down here where we're at webinars, which is for tonight, and we're going to dig into this in a second. But before we talk about today's guests, when you get over here near the bottom are the links where this video will be posted first of the week, all four of these channels. So whether it's on the Bright Rumble, Brighteon, BitChute, YouTube, all of it. Now, the other thing that's important too is, as you'll discover for tonight, once we hear this, we're not kind of like done. She's going to need us to continue helping. So we're going to go to continuing the conversation and have a way to follow up and connect with everybody after the fact, which is really critical. And then I failed to open it, but it's also important. We also have everybody that's fighting for freedom. And this is where, like we had a guest earlier today, we have all the action items there at the top, and then all the different organizations, and we keep adding, that are helping make this happen. And frankly, a lot of people don't even know half of these exist. And some of them that are in some of these organizations never keep tabs on or know about each other. So it's a great way for everyone to connect in the freedom world and be that disruptor's center, as it were. And like I said, we are having that revolution in healthcare, and here's a little bit more under that. When you come to the health area, there's some great stuff to find out about that and how the health app works and so on. So, but on that note, let's go back to the webinar screen here a minute, and let's let Charles tell us a little bit what we've got in store for us today. So here we go.
Gladly, Jeff, and welcome, Hadley. I heard first about the Independent Women's Forum via the Repeal Coalition of various interests behind the effort to upgrade the Affordable Care Act to something protective of people's need for good health care, but without so much of the red tape that was making it too expensive for a broad swath of the middle class. And Jeff did, I think, interview Hadley on our old YouTube channel or something a couple of years ago, but we definitely want to bring her back in our new modern platform that we've developed over the past year and a half or so, especially since Hadley has a good subject to discuss, and that is, how do you communicate free market healthcare reform in a way that speaks to that large swath of independent voters who may not specifically be in our choir yet. It's one thing to beat over someone's head fundamental, truths about free markets and all that, but given that healthcare really has hurt the Republican and conservative causes over the past few years, maybe because our messaging isn't getting through, we do need some coaching on how to improve our communication skills and to paint that picture of a better health market that folks want. Hadley has appeared on Fox Business, on cable, and she's a very well-spoken advocate for good policy. So we're looking forward to tonight's guest, Jeff.
All right, fantastic. Well, on that great note, I'm going to shift gears and free up the screen. And Hadley, if you would do the honors.
Sure. I trust that everyone can see me and hear me, and I'll share my screen in just a moment to start my presentation. Thank you for the lovely introduction, Charles. I have been with Independent Women's Forum for a little bit over 10 years now. It's an organization based in Washington, D.C., mostly focused on public policy at the national level. Our motto is all issues are women's issues. So we do policy work across a broad spectrum of public policy issues. I'm our director of policy. Prior to holding this position with IWF, I was director of health policy. So I've been really focused on the healthcare issue for some time now. I think I joined IWF actually in 2010, which was the year that the Affordable Care Act passed. And IWF and our sister organization, which is Independent Women's Voice, both disagreed with sort of a lot of the premise of the Affordable Care Act and thought that not only was the law flawed in its sort of execution, but was also flawed in its design and in some of the underlying premises used to push forward that law. And so initially we started a coalition of organizations, which Charles mentioned, called the Repeal Coalition. We co-founded this coalition with Americans for Tax Reform, and we worked to push back against the Affordable Care Act. Of course, the effort to repeal the Affordable Care Act ultimately failed. There were many times I thought we were close. I thought that the initial Supreme Court challenge to the individual mandate was maybe the best shot at overturning that law. But we've been living with the Affordable Care Act now for about 10 years. Of course, the main pieces of it weren't implemented until 2014 or so. But I'm sad to say that some of the things that our organization predicted about the Affordable Care Act have come to pass, and I'll discuss this in my presentation. But first, I want to tell you a little bit more about the organization more broadly. It's about 27 years old. We are an all-female staff. We have a staff of policy and communication staffers. We do a variety of things to advocate for our mission. Our mission is to develop and advance policies that aren't just well-intended, but actually enhance people's freedom, choices, and opportunities. And we do this through publications. We do it in the media. As Charles mentioned, we have good relationships with a lot of the media outlets, and we do it also on Capitol Hill through congressional testimony and through interfacing with lawmakers directly. So that's a little bit about IWF. I'm very proud to represent the organization. We really try to communicate, our public-facing communications are very much aimed at persuading people who may not share our perspective, may not share our worldview, may not share our policy positions. And so that's a little bit what I'm going to share tonight is sort of some tips that I feel like I have learned sometimes the hard way in terms of being a communicator about healthcare policy. And so with that, if it's okay with you guys, I'll just share my screen and get started with my slides. I guess everyone's been following the news today. Big news, of course, coming out of Washington, D.C., but big news also coming out of the state of Georgia. It looks like Democrats will control all, the two legislative branches of government, at least the two houses of Congress, and then the executive branch. So I'm going to talk a little bit tonight about how to stop and reverse government overreach in healthcare policy, how to expand gains for freedom. Believe it or not, there were some gains for healthcare freedom during the last 4 years, and specifically during the COVID-19 pandemic. And then I'm going to talk about how to turn healthcare, which has been a political liability for people who are conservative or libertarian, how to turn that political liability into a strength. So first, I thought I'd talk a little bit about what to expect in the next year, 2 years, 4 years with the Biden administration, particularly now that we know that he'll have a friendly Congress and a friendly Senate. And these are all phrases and points directly from the Biden campaign website. I want to be fair and sort of represent their agenda accurately. They say they want to protect and build on the Affordable Care Act. They want to offer a public health insurance option like Medicare, which would be free of premiums in any state that did not expand Medicaid. So essentially, an expansion of a premium-free government health insurance program in all states. And they would increase subsidies for Affordable Care Act plans on the exchanges. They'd expand eligibility for those subsidies so that they wouldn't just apply to people who are income qualified today, but would apply to people who, regardless of income level, are shopping on the ACA exchanges. They would allow Medicare to negotiate lower prices for drugs. They would limit prices for drugs using price ceilings effectively. And they'd repeal the Hyde Amendment to the Mexico City policy. These are prohibitions on taxpayer funding for abortion, both domestically. The Hyde Amendment applies to domestic policy, and the Mexico City policy applies to international or foreign aid funding. And then they would restore or increase federal funding for Planned Parenthood. So this is sort of the pieces of their agenda that they have chosen to highlight on, at least on the campaign website. And I take them at their word that these are their goals. And so my first suggestion or my first tip is, I hope it's a surprising one, but if you believe in healthcare freedom, my first suggestion is going to be, rather than read through the list of policies that the Biden administration favors and immediately take a defensive stance, I recommend that we instead go on offense. And given that I think we have a Super Bowl coming up in a few weeks, I thought I'd go with a football theme for this slide. But I often talk about healthcare policy as a continuum. And there's, on the one hand, the end zone for people who believe in socialized medicine. And on the other hand, there's an end zone for people who believe in healthcare freedom. But there's a variety of steps that policymakers can take in either direction that move us closer to one end zone or the other. And I've got the Affordable Care Act kind of at the 50-yard line, because that's where we're living right now. But there's a public option, which Biden has said that he supports. There's Medicare for all, and I believe that the public option would move us towards Medicare for all. And then there's insurance deregulation, which is another way to put Affordable Care Act repeal. I mean, there's deregulation at the federal level, which would be hard to do without significantly changing the Affordable Care Act. And then there's insurance deregulation at the state level, which is also, kind of a moot point until we can change the federal regulations that require all health insurance plans to be priced essentially the same way and to be sold essentially the same way and to include essentially the same coverages and features. And then there's large HSAs, which is another way to say that people could have universal access to health savings accounts. This would equalize the tax treatment of your health insurance coverage, regardless of if you get that insurance coverage through an employer or if you buy it on your own. And this has long been a policy goal of more conservative or libertarian health reformers. So that's just to give you an idea of what the continuum of healthcare policy looks like. And I think it's helpful to use this framework because it helps us to step back and say, not only what are the sort of practical effects of each policy proposal, but where does it move us in terms of the end zones? Is it something that will be helpful in terms of improving healthcare freedom, or is it something that's going to move us closer to socialized medicine? And a lot of people don't seem to understand this in the general public. And of course, with any effort to communicate about any policy issue, it's important to understand where your audience is sort of at baseline. And many people, at least 18% of Americans, say they favor a public option, but they oppose Medicare for all. So they don't seem to recognize that the public option is a stepping stone towards Medicare for all. And this is something that many, even Democrats as lawmakers, have been transparent about, that during the debate about the Affordable Care Act, there was some consideration of a public option, and some of the lawmakers said, I favor a public option specifically because I believe it's the best path to get to single payer healthcare. And this was also the case in the sort of the campaign season that preceded Biden's nomination, but some of his sort of rivals in the Democratic Party, whether it's Elizabeth Warren or Pete Buttigieg, were very transparent about the fact that they would start with the public option sort of as phase one, with the ultimate goal of moving towards Medicare for all. So I think one way we can go on offense as advocates for more healthcare freedom is to simply connect those dots for people and say, the Affordable Care Act moved us closer to a a place where more Americans are dependent on government for their health insurance coverage. A public option moves us in that same direction that ultimately has the effect of crowding out private insurance and private healthcare in general, and moves us closer to a Medicare for all system. So that's, I think, a pretty low-hanging fruit and something that's pretty easy for healthcare advocates to do. And I think we also have to, as we go on offense, continue to revisit the debate about the Affordable Care Act. I mean, a lot of people might think that this is old news, but I do think that the public view of the impact of the Affordable Care Act is more or less predictive of people's support for more government and healthcare broadly. So if people favor the Affordable Care Act and they see it as ultimately something that benefited Americans and improved the lives of people, that makes them more open to and more in favor of other health reforms that continue on that same path. So I've included a slide from Kaiser that sort of shows what the favorability or unfavorability of the Affordable Care Act has been over time. As you can see, there were some times when more Americans found the law, as they had an unfavorable opinion of the law, and fewer people had favorable opinions. But then in more recent times, certainly basically since the start of the Trump administration, people seemed on average to have a more net positive favorability towards the Affordable Care Act. And so because of that, I say that even though the Affordable Care Act was a policy failure in many ways, it has been a political success, and it has been a great talking point for Democrats and a real bludgeon against Republicans, and in large part due to some misperceptions about the way that the law has worked out in reality. And here are some of the key ones. These are just some points that I use when I'm talking about the failures of the Affordable Care Act. Many people perceive the Affordable Care Act to be a big expansion of private health insurance coverage. That's not really the case. In fact, 75% of the newly insured under the Affordable Care Act were simply added to the Medicaid program, whether they were newly eligible because of the Medicaid expansion or because they were always eligible for Medicaid and the enrollment push that came with expansion added them to those roles. Some of those people were previously insured through a private health insurance plan, but they were shifted into the Medicaid program when they expanded in the states that opted into the expansion. And sadly, many people with private health insurance had their health insurance plans canceled or changed due to the regulatory changes required by the Affordable Care Act. I was one of those people. I had a private health insurance plan that I bought directly from a carrier. And in, I think, October of 2013, I got a cancellation notice letting me know that my plan was not compliant with the Affordable Care Act, and I had to re-enroll in a different plan that was ultimately about twice the premium and also had a higher deductible. So that was the experience of a lot of people with private health insurance, and that was a broken promise because, of course, the promise was if you like your plan, you can keep it. And more on that in just a moment, because that continues to be a promise that advocates of socialized medicine are making that's not accurate. The Medicaid expansion did not improve health outcomes. This is a big one. I think, understanding the motivations of people who want to expand Medicaid or Medicare or ultimately have Medicare for all, they want universal health coverage, and they want it generally because they're concerned about the well-being of their fellow citizens. That's a very noble intention, noble cause. However, it seems that people confuse health coverage with access to good health care. This is a frequent sort of confounding of two different things. You may have health coverage if you were included in the Medicaid expansion, but you may not necessarily have access to very quick or very high quality health care. And this is particularly true for people in what I call the traditional Medicaid population. So in all 50 states prior to the Medicaid expansion, if you were low income children or pregnant or disabled or elderly and you were dual eligible in Medicare and Medicaid, you had there was some qualification, some eligibility for those groups in all 50 states. However, the Medicaid expansion increased the income threshold and also allowed people to enroll in Medicaid who did not fit any of those eligibility requirements. So in other words, they could be childless adults who are working age and able-bodied. And when you increase the number of people in Medicaid, but you don't also increase the supply of healthcare services to that group, that is the number of doctors or hospitals available to people with Medicaid, then you create a mismatch in supply and demand. And there's at least one study that shows that in states that expanded Medicaid, there was a lower acceptance rate among OBGYN doctors for Medicaid patients than there was on average in the states that did not expand Medicaid. So to translate that to basic English, you would have been better off as a pregnant woman on Medicaid in the states that did not expand Medicaid, because you would have found it easier to find healthcare and to find a doctor who would accept your coverage. So I think it's important to point out, not only did Medicaid expansion not improve health outcomes, but it actually made access to healthcare more difficult for people in certain situations. And then the last thing I'll say about the Affordable Care Act is that it didn't protect coverage for chronic conditions. You know, this is one of the probably the biggest misperceptions about the Affordable Care Act, and the reason that it's such a political third rail is that as soon as you start to talk about healthcare policy or the Affordable Care Act, people want to know, well, what do you think about pre-existing conditions? And that's the buzzword, right? But I think what many people misunderstand is that prior to the Affordable Care Act, if you had a chronic health condition, if you were Medicare or Medicaid patient or beneficiary, if you were enrolled in an employer-provided health insurance plan, then you were already accepted for coverage generally, regardless of your health status. It was only in certain situations for people who shopped for insurance on their own, if they had a coverage gap or a true pre-existing condition, a condition that pre-existed their health coverage, that they might face a policy denial. And even so, in many states, there were state level policies designed to mitigate that. Some states had regulations like the Affordable Care Act that required all health insurance companies to take all comers, or what's called guaranteed issue. Those were the states with the fewest carriers and the highest premiums. And then other states, about 35 or 36 states, had what are called high risk pools designed to provide a place for people to shop if they couldn't get insurance in the broader private market. And then I also mentioned that newborns face no underwriting for health conditions before the Affordable Care Act. And this is basically the Billy Kimmel situation. I don't know if anybody watches Jimmy Kimmel, the sort of late night comedian, but he gave this very heart-wrenching story about his newborn son, Billy Kimmel, who was born with a heart defect. And anyway, not only does the Kimmel family have great insurance through NBC, I'm sure, but there would not have been any policy denial to a child in that situation before the Affordable Care Act, although Jimmy Kimmel wrongfully credits the ACA with saving his son's life. So this is sort of a picture of the many, I think, misperceptions that people have about the Affordable Care Act. They run very deep and they're very widely accepted among the general public, which makes it very difficult for us to have a forward-looking conversation about healthcare until we sort of clear up some of the misperceptions about what has already taken place due to the Affordable Care Act. And with that, I'm explaining sort of why this is important, and I mentioned some of these things, but people do desire universal coverage. They think the Affordable Care Act moved us closer to that. In fact, there was an increase in insurance coverage, as I mentioned, primarily driven by Medicaid expansion. But 67% of people who support Medicare for All believe that their insurance would go unchanged, even if Medicare for All were to be enacted. And so that's a big point of contention. You know, some Democrats say they support Medicare for All and that it would only be an option. Meanwhile, people could keep their private health insurance plans that they have today. Again, that to me sounds like an echo of a 2009 promise that was ultimately broken due to the Affordable Care Act. But there are others in the pro Medicare for All category who are a little bit more straightforward about the reality that Medicare for All means for all, and it means the abolition of private health insurance. This is even built into the design of, for example, Senator Sanders' specific proposal. And so I think that's another misperception that we can sort of reveal to people. If you're a supporter of Medicare for All and you believe that you would keep the same insurance policy even through the enactment of such a seismic change to our health insurance system, then you may be mistaken about the reality that Medicare for All will bring. And then, finally, I included some of these beliefs about chronic conditions or pre-existing health conditions. many people believe that the Affordable Care Act is responsible for protecting the insurance coverage of 129 million people. This is something that Kamala Harris actually said during the debate about repealing the Affordable Care Act, and it got 4 Pinocchios from the Washington Post. So, when you've lost the fact checkers at Washington Post, you're not being accurate. Here's my tip number 2, and I hope that if you guys take away anything from tonight, maybe this is the easiest thing to remember. But there is a terminology trap in debates about healthcare policy, and as you can see, the things that I've put in the left column on my slide are all things that sound nice and inviting, and actually focus on more or less the outcomes. Even saying the public option, oh, it sounds like a nice new choice or a new option. It doesn't sound scary or intimidating. Meanwhile, the things on the right, maybe there are some of us on this webinar who think these things all sound great, but unfortunately to the broader public, these terms are often just confusing. They don't really necessarily know what's meant by these things. Even saying high risk pools, people don't like to see themselves as high risk, even if they have pretty costly medical conditions that would be hard to insure in a private marketplace for insurance. Risk rating sounds scary. So I sort of highlight this just to suggest that the playing field is not level at all when it comes to the healthcare policy debate. George Orwell knew that when you control the linguistics of a debate, you've got a huge advantage. And unfortunately, that's what I see happening in healthcare policy today. One interesting one that I've included on here that I just wanted to note is healthcare system. I really try to just avoid using this term altogether because I think it buys into the premise or the suggestion that we should have one healthcare system, when in reality, what I think that we should have is a robust marketplace for healthcare services. And it's very hard because healthcare system is such a neat and tidy term, and I'm sure we all use it all the time. But in the next slide, I've included sort of some suggestions for what's, I think, a little bit more honest terminology about policy proposals from the left, and what I think is a little bit better marketing for the policy proposals that come from the right. One term that I left off the list that I meant to include, and this is sort of, I think, another part of what's confusing or difficult about breaking down healthcare policy proposals, is that much of what we talk about when we talk about health policy or healthcare policy actually doesn't relate to health care that directly. It really has to do more specifically with health insurance regulation or health coverage. Actually, after the Affordable Care Act, I think it's harder to describe what most people purchase in terms of a health plan as insurance. Insurance in, broad definition is a financial protection against risk. It's a financial backstop in case of more or less a catastrophic or unexpected cost. And that is simply not what health insurance is in the United States today. And so I tend to use the term health coverage more because health insurance just seems like a dishonest descriptor for what people are buying and selling in most cases when it comes to health coverage or health plans in the US today. And people on the left particularly tend to almost, I want to say, maybe this is unfair, but I think it is intentional. They use the term health care when they really mean health coverage or health insurance. And again, as I sort of highlighted about the Medicaid expansion, those two things are not the same. Health coverage and health care are not the same. Just because you have health coverage does not mean that you have access to health care when you need it. So this is my second tip. My first tip was go on offense, and my second tip was avoid this terminology trap if you can. Just, you can control the way that you talk about it. You maybe can't control the way other people talk about it, but every person's voice matters here. My third tip is don't defend the status quo. This is, I think, when we're faced with policy proposals that we disagree with, like Medicare for All, our temptation is to sort of start defending the status quo. But as I sort of showed with the healthcare policy continuum, we're not in the end zone for healthcare freedom by any stretch of the imagination. We're sort of in a world where, yes, you could say that we have a quasi-public, a quasi-private health atmosphere. I don't want to say healthcare system, but sort of a healthcare environment today. And we want to move the ball closer to the end zone for healthcare freedom. I don't believe that we have a healthcare crisis in the U.S. I mentioned before the webinar started, I'm married to a physician, and I think we have some of the highest quality healthcare available in the world. People come frequently from other countries to the United States for care. I think the World Health Organization ranking that suggests we're like 42nd in the world, and some of these other international comparisons are way off because they rely on bad data, basically, about infant mortality and some other metrics that are not measured equally across countries. And I also think it's not right and not fair to use longevity as a metric for the healthcare delivery in the US. But we do have very high health care available if you can get it, if you can afford it. And so for that reason, I say we have a health cost crisis, or we have a crisis in how we pay for healthcare. And so it's I think much more credible to take the position to say we do have problems in our healthcare system, but Medicare for all or single payer won't fix those problems. In fact, they'll make some of our problems worse, and recognize that many people are dissatisfied with the status quo. And this was the case before the Affordable Care Act. Even though people were maybe more satisfied with their personal health insurance plan than many people realized, they were not happy broadly with the status quo in American healthcare. And so my next few slides are sort of suggestions for at least what we at IWF have been focused on for the past year or so in the midst of the COVID-19 pandemic, in terms of what we think some good themes or policy solutions are that we can highlight as alternatives to some of the bad ideas that we see often floated around. And so I've sort of framed these three things as problems and solutions. Our healthcare system is employer-centric. There's no way around that. That's been the case for decades in the United States, sort of an accident of history. But this doesn't work for a lot of people. And the Affordable Care Act actually, I think many of the people in favor of the law recognized this and wanted to mitigate this, and had good intentions with, for example, the tax credits that are available in the exchanges. However, this is one place where I would say there are better ways to mitigate this problem. And one that we often talk about at IWF is expanding health insurance options, making, more basic plans available to people who would choose them, and making health savings accounts universally available. But this is one where actually people who advocate even for Medicare for all, I think, would agree that the employer-centric nature of our system is not working well for many people. We just disagree on what the solutions should be, but recognizing that there is a problem rather than pretending that the problem doesn't exist, as I think a better way to reach people. The second problem that many people see and feel very frustrated about is the lack of transparency, particularly in pricing when it comes to healthcare. And some of this is due to simply the very confusing pipeline that we use to pay for healthcare. Many people are paying for healthcare through their wages, they're paying through their insurance premiums, they're paying through other cost sharing, copays and deductibles. And they're not always clear on what those pieces will look like. Certainly the topic of surprise billing has been in the news and has been the subject of much discussion recently. But we recognize that having more price competition and having more price transparency will ultimately result in lower prices. And I so appreciate what Jeff and Charles are doing with the cash patient model. And we want to work towards a policy environment where that's a more popular and more doable option for more people. And so I do think what we have today, unfortunately, with health care and health coverage being so strongly linked, is a lack of competition. I don't really make a lot of choices. I highlight this to people often, and with the status quo, I don't make a lot of choices about my health care. We have the health insurance plan that has been selected for us by my husband's employer. And we go to the hospitals that our health insurance plan has selected for us. And I see the doctors that hospital has chosen to hire. So I haven't made any of those choices. Those choices have all been made for me. And that's very restrictive. So, yet again, we don't have to defend the status quo. We can recognize there are problems in the way Americans consume healthcare, but we don't have to resort to sort of government-centric solution. And then the last problem and solution that I wanted to highlight, and this might be of particular interest to those of you who are more on the healthcare delivery side, is that prior to the pandemic, there were a lot of rules in place that simply added to the sort of bureaucratic nature of how healthcare is delivered. And some of those got waived almost instantaneously in order to make it easier for healthcare delivery systems, hospitals, and so forth to amp up their capacity and to amp up their supply, essentially, of their services to make room for more COVID-19 patients. And it was really amazing. It was an amazing thing to witness. I live in the state of Colorado, and our governor Polis, who is a Democrat, was very strong on this, very good about working directly with doctors and hospitals to say, what red tape can I get out of the way for you so that you can do your job? And this should be and the instinct of our government, even outside of a pandemic, is to say to the professionals in the field, what can I do to make it easier for you to do your job? Of course, we want patients to be safe, and there's, a good argument to be made for some basic regulations. However, many things that are, happening in healthcare, for example, I would highlight certificate of need laws as an unnecessary type of restriction or regulation on healthcare. Those things aren't necessary, and they aren't beneficial. And hopefully the pandemic was one way that people started to realize that those things are more harmful than good. But anyway, in summary, these are my 3 tips. Go on offense, connect the dots between what are presented as moderate proposals like the public option with the ultimate end game of socialized medicine, set the record straight about the government's track record on providing healthcare and health coverage. And tip number 2, avoid the terminology trap. There's fair language that I think we can use to describe what's happening in healthcare policy. One of my tricks is to use the toddler trick. I have 2 preschoolers in my home, so they ask me, but why, mommy, why? They ask me the question why a lot. And so I would say, if you're talking about, for example, free market healthcare or large HSAs or high risk pools or whatever the policy is that you're advocating for, maybe spend some time thinking about what's the ultimate benefit to the everyday person of this policy change, and use that in your communication about it. The left is very good about this. They talk about access to healthcare all the time, and our side typically tends to name our policy proposals in terms of what the policy changes or what the policy does, rather than how it benefits people or what the ultimate end result of the policy would be. And so if we're using equivalents on either side of the political aisle, then we too should talk about how our policies benefit people and what the ultimate goal of our policies are, not simply what they look like in terms of the legislation that gets passed on Capitol Hill. And then finally, my 3rd tip is don't defend the status quo. Don't feel boxed into defending what I think is best described as crony capitalism and the quasi-private, quasi-public system that we have today, but defend true free market capitalism and offer that alternative vision, what it means for people in their everyday lives and the way they consume healthcare, and then be prepared to articulate concrete policy steps that would move us closer to the end zone on that one. And then my last slide simply has more resources and suggestions for anybody who wants to follow up with this discussion or with our organization. Healthreformquestions.com is a website where we have a few quizzes about healthcare reform. Those are fun. And then we have at the bottom of that page links to more of our policy papers and a communications guide that we refer to frequently on healthcare policy. And then IWF.org stands for Independent Women's Forum. IWV stands for Independent Women's Voice. That's our affiliated 501c4 organization. But this sort of wraps up my slideshow, and I saw a couple people had raised their hands. I'm not.
We've got hands. We've got hands.
Okay.
I'm gonna kick it off though, since I'm hosting. I'll
Okay.
jump in the front of the line there.
Okay.
One thing, it's good. What you're showing is, we've always had good ideas. There's always been these great ideas. It's just been articulating them, or like you said, moving them in some place. But also, what was great, you point out, was the idea of having control of the language. And I just remember from Charles and I have been working in this push towards classical liberalism again. And the Second Amendment is kind of a cornerstone of some of that. And then suddenly the terminology gun control showed up. And rather than refute it, they just accepted that terminology. Next thing you know, you're on a hook. But a lot of people in the liberty said, well, why would you be for victim disarmament?
Yeah.
And boom, suddenly the whole thing changed. So, but anyway, so it's great that you're doing the same thing here. One of the questions I had was, if they got to that Medicare for all, where like they've said, like Camilla, that they want to be done with insurance, what happens to that industry? Where do all those people go? That's an enormous quantity of people. And then secondarily, that's a huge imposition on doctors. What are they going to just suddenly say, okay, docs, no, you're going to work for this many hours all life, and here's what you get paid? I mean, who's going to put up with that?
Yeah, it's interesting. So in my advocacy efforts on this, I really try to, this is another tip that I've learned over the years, sometimes the hard way, is that it's always good when we can to cite news articles or public policy position papers from organizations and news outlets that are outside of the conservative libertarian movement, right? And so the New York Times actually did some reporting about what the impact of Medicare for All would be specifically on rural hospitals. And they quoted experts, not right-wing people, but experts who are kind of on the left, who said, yeah, a lot of rural hospitals would have to shutter their doors pretty much overnight if Medicare for All did what it purports to do, which is lowering the cost of healthcare simply by using price ceilings effectively on reimbursement for the services that they provide. And so that's, rather than saying, here's what I speculate would happen, I try to point to, here's what the New York Times has reported would happen. Certainly in terms of the insurance industry, I actually did a Fox Business interview about one report that showed how many people would be out of a job if the private health insurance industry were to just vanish overnight. And this is one that I'd be careful with because, of course, I don't want anybody to be out of a job. However, I do think there is, unfortunately, in large part due to the Affordable Care Act, a lot of administrative bloat in healthcare and in health insurance. And I would love to see more efficiency. And sometimes that might mean the elimination of a job or a decrease in costs. And ultimately, as a patient, I want to see those decreases in unnecessary bureaucracy and overhead and costs. However, I want to see that happen through the organic changes that market competition would subject insurers to, rather than to see it happen through government takeover, essentially, of insurance, if that makes sense.
No, that's exactly what's going to be my counter argument, what you were describing, because if we allowed it just to occur, then it would just sort of attrition away by itself over time, and nobody would really officially lose their job, as it were. Well, guess what? We've got some hands up.
Great.
Kishore, I see yours up.
So I have actually a couple of questions.
Okay.
And they're kind of related. So there was a recent article written by Doug Shawn, and he emphasized the need to demonopolize the hospital industry. And he sort of expressed some optimism that it can be done because the person who's going to take over HHS, Xavier Becerra, has been taking action against Sutter Hospital in California. So when I read that article, I asked myself, where is this coming from? It's just totally unexpected. None of the hackneyed ideas were rehashed. So is it possible then that, the rise of hospital, especially drug prices, and he also mentioned the need to remove the middlemen involved in drug pricing. So is it possible then that the reality is sinking in and it's no longer possible to spin away the massive increase in healthcare pricing? And that could be then the peg for arguing for free market healthcare.
Yeah, that's certainly an opportunity that our organization has identified. And I don't know how many people on this call have read. I've got on my bookshelf a book by Marty McCary called The Price We Pay, which is a really interesting dive into sort of the unexplainable and seemingly wrong price disparity for healthcare services, even within the same hospital, sometimes depending on who your insurer is or how you plan to pay. And so certainly I think the frustration with the lack of price transparency and a lack of price competition in healthcare is a huge opportunity for reformers. It's an opportunity for reformers on both sides of the aisle. And so I think, again, articulating how one solution is better than the other will be very important here. I did see on the Biden campaign website, as I was reviewing their sort of healthcare agenda, many things that I agreed with, some in goals that I agree with in terms of subjecting hospitals and insurance companies to higher levels of market competition. That's something that I agree with. However, I don't think that some of the policies that the Biden administration supports will actually do that. I think, we have to judge policy not just by its intentions, but by its outcomes or its results. And I, for one, believe that a large part of the consolidation that we've seen, particularly in the health insurance industry, and maybe also when it comes to I call it the Pac-Man effect, where hospitals are just buying up the private practices, and their hospitals have really turned into conglomerates in a lot of ways over the past 10 years. We've seen that trend. I give a lot of the blame for that to the Affordable Care Act because of the way that it has made it so difficult for small insurance companies and small healthcare practices and providers to survive in a paperwork and bureaucratic and payment environment that's so challenging for them. And so it's hard for me to really give a lot of credibility or put a lot of stock or hope in the Biden administration when it comes to increasing market competition, when Joe Biden was, standing there with President Obama when he signed the Affordable Care Act, which I think destroyed or really restricted market competition in a harmful way.
Dr. Campbell, I see your hand up.
Oh my, yes. Hi, Hadley.
Hi.
I'm very impressed with your
you.
presentation. So, one of the things that I found, and I can never say no to healthcare reform. I'm kind of a practicing physician for 32 years, and I've been involved in a lot of projects. And maybe offline, I'd love to introduce you to a project that I wrote called Healthcare for You, which was adopted by the JCN and
I'm familiar people. Actually.
Yeah. I mean, I really, what you're saying resonates with so many things that I've studied for 32 years. What I'd like to ask you though is, where do you go? I mean, you seem like, you're a very knowledgeable policy person. Where do you go to get change to occur? I've been promised by President Obama that he would use some of my middleman information, and he just simply took it and used it to fund Obamacare. Then I've been promised by Trump that he would do things, and he did it. Yeah, in October of his 4th year of office, he adopted some of our policies. Right now, the Republicans, who I say, and I've told them to their face, that they run from this, they run from healthcare, but now they're promising they're going to adopt Healthcare for You and modify it. So I'm wondering, where do you go where you get sincere effort at really fixing healthcare at 18% of GDP? Where should I go and where do you go?
Yeah, well, one challenge that comes to mind when I hear you speak about this is that Healthcare for You, and of course, you might be familiar with the Healthcare Choices Plan that Grace Marie Turner is championing with the Heritage and Galen Institute. There are some really big, ambitious reform proposals out there, and that's one reason I'm constantly frustrated by the talking point that conservatives have no plan, libertarians have no plan. There's a plethora of plans, maybe too many plans sometimes to reform healthcare in a direction that I think would be better. But one of the challenges with doing that, and it's the political challenge, is that we want the whole loaf. You know, we want healthcare freedom, right? And it seems harder for conservative reformers to take the loaf a slice at a time. Meanwhile, I see the political left very willing to do this. They'll take the loaf a slice at a time. And that's what they've been doing. That's what they will continue to do. However, as soon as you start to talk about, for example, the 2017 effort to repeal and replace the Affordable Care Act, did I think that the American Health Care Act was ideal healthcare policy? No, I think there were some big problems with it. Kept a lot of the pieces of Obamacare in place. Some people called it Obamacare light, right? And that became like a defamatory message to use against this Republican effort to repeal and replace the Affordable Care Act. But would it be better than Obamacare heavy? You know, that's the challenge is our team willing to take the loaf a slice at a time? And I don't know, because I can point to, for example, bills that Senator Rand Paul has sponsored that I think are great in terms of policy. However, I question the political feasibility of such ambitious changes in the immediate term. And so I don't know if this really answers your question, but I do think our team has to get creative about incremental policy changes that we can do. And that's what I think that some of the price transparency work of the Trump administration was sort of aimed at. But it's just a very tough environment. I mean, even before we had President Trump, I'll just be real transparent and say, I was really disappointed to see Mitt Romney take the Republican nomination in 2012, because I thought, wow, Republicans are going to nominate the guy who was responsible for Romney Care in Massachusetts, which is something, another healthcare policy that I thought was really flawed. And so I really haven't felt like for a long time that there's a lot of champions for healthcare freedom who can also be really effective in this political environment. So I think your question's you've kind of stumped me. I don't really have anything positive to say, except for I recognize that there's this big challenge when it comes to advocating for healthcare freedom. It seems like we have this vision and we do an okay job articulating it, but it's very hard for us to take incremental steps towards it.
You know,
well, I have to say, I would love to work with you over time and achieving the things that you want to do, slice by slice, if that works.
Yeah.
And some
of the
I'm
things,
very
you know,
familiar with all these initiatives. And I know the people who we're working on price transparency, and it's the hospitals are saying we'd rather take the fines.
Yeah, I know. The fines aren't very much compared to.
So I'd love to work with you on that. And I guess I would just say to the group in general, one of the things that I became very frustrated with is just this lack of moving the ball. And so we formed a group, really what I call a coalition, called Free to Care. And we now have 27 organizations, 90,000 physicians, and 8 million patient advocates. And we're growing. That's since April the 1st. So those are two things. Read Free to Care. We have 5 propositions. Take one of them and run with it. And I'd love to work with you down the road. So, and great presentation. Thank you.
You know, it's good. You know, it's an interesting observation on what you guys were just talking about. And Charles got a question, but maybe you can comment on this similarly. With that app that we were showing at the onset, it's been effective because it's a chance for someone to actually live what we're talking about. It's like describing chocolate all day, but if I give you a taste of it, you're like, whoa, I had no idea. And so just getting a chance to do something cash oriented, something like, wait, this is good. I like this. I think I want more of this. Because without that groundswell at the bottom, I don't think we're going to ever get out of the pickle. Charles, what's your thought?
Thanks, Jeff and Hadley. Great presentation. I agree. And thanks for the plug. Forbes did feature Jeff and my company for creating cash patients using an alternative to insurance, a sharing community embedded with the proper high deductible vehicle that allows for an HSA, which we're big proponents of. And on this call, there's a few folks, Jeff, I would love to have comment if we have time.
Certainly.
3 in particular. Dr. Marilyn Singleton for her work at AAPS, which has had a lot of women leaders. And I would love to have Dr. Singleton comment about, let's combat that feeling that women suburban voters voted for big government Democrats out of fear that Republicans were going to take away their health care. And Dr. Singleton's organization is full of women leaders who every year run AEPS with great free market ideas. And then Carl Hall to talk about his leadership in HSAs. And finally, Abigail to talk about healthcare leadership on the state level. We don't have much time, Jeff, but those are three people I'd love to hear from.
Okay, great suggestion. Dr. Singleton, you want to jump in there?
Hi. Hi, Hadley. Thank you very much for the presentation. I've been out in the street, so I'm not showing you my real picture. You can just see me shouting in a microphone. But with regard to women and suburban women, and as a Black person as well, I always find it strange when people talk about suburban women or this group or that group, because of course we're all very different. And I thank you, Jeff, for mentioning our past, 3 presidents have all been women, and that clearly we know women can do as much as men. And I don't think, oh, there's my dog, women are worried any more about men than having their health care taken away. But from people I know and groups I'm in, we're more worried about having our freedom taken away. And I think this COVID has really brought that out when, and interestingly, in a way, this homeschooling has taught people what propaganda is being shoved down the children's throats at school. And that's bringing on this whole other liberty movement for having the so-called suburban mothers asking for more things and more choices. And I think this will spill over into healthcare, this mentality of realizing the government oppression, really. And so in a way, I'm kind of trying to be the Pollyanna about what's come good out of all this, is that we will be more libertarian minded and more freedom minded.
Thanks. I'm glad you mentioned education, because I think it's well, the pandemic has certainly turned that world upside down. But I have thought so many times during this pandemic, thank goodness my family has the resources to send our children to a private preschool. I mean, if I were dependent on the local public school for our early childhood education or something like that, my children would have been doing virtual preschool, which is a joke. It's like an oxymoron to say virtual preschool. Preschool is hands-on. You know, they have to get their hands in the Play-Doh and all that. So, but I mentioned that with regard to my healthcare presentation, because when we talk about having a public health plan, we can see from our education system exactly how that's going to go. We're going to, you know, ultimately maybe have a public healthcare system. It's truly a system where you're assigned your hospital based on your zip code. That's what we do at school. And where people who are wealthy enough and who have the resources to opt out will opt out. And we'll have a private system that will be 2-tiered, and the haves will have and the have-nots will not. And that's, I think, should be a cautionary tale about the direction that our healthcare policy could go. But thanks for your work, and thanks for sharing that.
That's good. Abigail, we're going to let you slip in a last comment here. We're running out of time.
Thank you. I really appreciate the wonderful information. I love your football field analogy, even though I have never watched a football game in my life and never plan to. It's a great analogy. I like too the placement of public opinion in there. It brings up the Overton window. And what is possible for policy totally depends on public opinion. So thanks to everyone for what they're doing with that.
Hadley, I'm going to let you take us out here with the last comment, and then thanks for today.
Oh, well, thank you so much. And I couldn't agree more that, you know, if we live in a representative constitutional republic, then what the people think really matters. And, you know, I think Thomas Jefferson was really big on having an informed populace. We have to have a populace that not only is educated enough to sort of understand what's going on, but also has the right information. And I think it's sometimes harder to help people unlearn things that are wrong than to tell them things that are right. And unfortunately, in the healthcare policy debate, there's been a lot of bad information, a lot of misperceptions. And so if we come in with our guns blazing and beat people over the head and say, you're completely wrong about this and we're completely right, a lot of people are going to tune us out, and rightfully so. But I hope some of my suggestions about just tweaking our language and connecting the dots between bad ideas and bad outcomes of those policies will be helpful to some of you. I'm still learning. I've learned a lot over my 10 years or so in health policy from many people that I should thank, but I'd love to continue the discussion with anybody who is interested in working with me or with Independent Women's Forum. My email address is hadley@iwf.org. And so feel free to reach out to me. And some people have sent me some messages in the chat window, and I'd love to follow up and do what we can to make health policy better.
Fantastic. Well, we're definitely going to incorporate, as I indicated, in that continuing the conversation aspect of the site here. Like I said, here we are. I meant to cut over here again. So we'll add you into this mix as well, so people can continue on, because they'll watch this video sometime from now, and could be 6 months from now, but this way they'll have a way to get back in gear with you there. So that's great. And thanks again for today.
Oh, thank you so much. Thanks. It was my pleasure. And I really appreciate the invitation and the opportunity.